As the chill of winter sets in, a silent battle is brewing in the air, one that could impact your health and the well-being of your loved ones. Respiratory virus season is here, and it's bringing COVID-19, influenza, and RSV along for the ride. But don't worry, there's a shield you can wield: vaccines. Yet here's where it gets controversial. Not everyone agrees on who should get them or when. Let's dive into what you need to know to protect yourself and your family. The Centers for Disease Control and Prevention, CDC, predicts that the 2025-26 respiratory virus season will mirror last year's peak hospitalizations for COVID-19, influenza, and RSV. Public health experts are unanimous on one thing: vaccination is your best defense. Dr. Hansa Bhargava, a board-certified pediatrician, emphasizes, "We're fortunate to have these protective measures, especially for our children. But it's not just about you. It's about herd immunity. If your community isn't protected, your family remains at risk. And this is the part most people miss. Vaccination isn't just a personal choice. It's a communal responsibility." So let's break down the vaccines available this season. COVID-19 vaccines. The CDC recently shifted its stance, moving from universal COVID-19 vaccine recommendations to an individual-based decision-making approach. This means anyone aged 6 months and older can get vaccinated after consulting a healthcare provider. But here's where it gets controversial. The FDA now restricts updated COVID-19 vaccines to those aged 65 and older or younger individuals with high-risk conditions. Most Americans will need just one dose, but some, like the immunocompromised or those 65 and older, may need more frequent doses. The American Academy of Pediatrics and the American College of Obstetricians and Gynecologists still recommend COVID-19 vaccines for young children and pregnant women, respectively. Yet, conflicting guidance from officials like Health Secretary Robert F. Kennedy Jr. has sown confusion. Is this a step forward or a misstep? We'd love to hear your thoughts in the comments. Dr. William Schaffner warns, COVID hasn't disappeared. It's still causing hospitalizations, especially among those not up to date with vaccines. Vaccination significantly reduces your risk of severe illness. Influenza vaccines. The CDC recommends an annual flu vaccine for everyone aged 6 months and older. This season, options include standard dose inactivated vaccines, nasal sprays for healthy individuals aged 2 to 49, and high-dose or recombinant vaccines for older adults. But here's a surprising fact. Even if the vaccine doesn't perfectly match the circulating strain, it can still reduce severity, hospitalization, and death. Dr. Schaffner reassures the flu vaccine is incredibly safe, with millions of doses administered globally each year. Side effects are typically mild, a sore arm or a day of feeling under the wear. RSV vaccines. RSV vaccines are recommended for adults aged 75 and older and those aged 50 to 74 with risk factors like chronic heart or lung disease. Pregnant women are advised to get the vaccine between 32 and 36 weeks to protect their newborns for up to 6 months. But here's a twist. Unlike flu or COVID vaccines, RSV vaccines aren't annual. One dose provides protection for over a year. For infants whose mothers weren't vaccinated, a monoclonal antibody shot is available. Dr. Bhargava stresses, protecting babies from RSV is crucial. Final thought, vaccines are powerful tools, but their effectiveness depends on widespread use. Are you planning to get vaccinated this season? Why or why not? Share your thoughts below. Let's keep the conversation going.